Most of the time when you want to do a medical course, it's either you want to do a degree or you want to do a diploma, depending on what you want and depending on the grade that you scored. And so today I'll be explaining on the diploma course because that is what is offered in KMTC, and I'll be answering the question of which grade do you require to be able to apply for a particular course, and that is nursing, like clinical medicine, health records and nutrition, and all the other courses that are offered. So let's get into the video. Welcome back, guys. If you're new here, my name is Lois Odwor, and on this channel I talk about nursing, give health talks and also do vlogs. So if that is something you're interested in, then you should consider subscribing. So you'll find that for most of these courses they usually require a mean grade of C for a diploma and a mean grade of C- for a certificate. That is not for all courses, but for most of the courses that is usually the mean grade of C for a diploma, a C- for a certificate. And that doesn't mean that if you have a higher grade you cannot go for a diploma, because I usually find that even for most of the people who are in our class, like almost 80%, they even got a B and above. So if you're interested in nursing and maybe you couldn't qualify to do it in the university, that doesn't mean that you just have to give up on doing nursing. You can always do it as a diploma, then you can continue advancing slowly as time goes by. So even if you got a higher grade, you can still be able to do a diploma course. So I'm going to go through the courses that I'm sure of, because we have a lot of courses here, but I'll just go through a few that are major ones and a few that I'm sure of. So I'll be doing for nursing, for nutrition, for health records, for clinical medicine. But remember, for most of these courses they're just almost similar. The grading is just almost similar, so I'll use the few that I know as an example for the rest of the other courses. So for clinical medicine, that is diploma, they usually require a mean grade of C in one language and C- in one science. For health records diploma, they usually also require a mean grade of C in one language and C- in math and a D+ in biology. And for nutrition, they usually also require, for them they require a mean grade of C- for diploma, C- in English and C- in biology. And for nursing, which most of you guys usually ask for, they usually require a diploma, they require a C, a plain C as the mean grade, C in one language and C- in a science. And for certificate, they usually require a C-. So for certificate, a C-, then a C- in one language and a D+ in one science. And for the certificate one, usually takes 2 years. The diploma is usually 3 years. For us, the diploma was 3.5 years. That's why I've taken the longest time here. But right now, the diploma is 3 years. And when you're done with the 3 years, even for clinical medicine, you usually go just into the job industry. It's not like for the degree one, whereby you have to go for internship before you are employed in any place. So 3 years and immediately you go into the job industry. And for health records, most of the time they usually do a certificate for 2 years, then they do a diploma for 2 years again. So most of the time it's usually 4 years, and some people come and advance the higher diploma one for, I'm not sure about the duration. But so that is it for the grading. So you can apply. I have another video on how you can apply for a KMTC course. So if you haven't checked that video and you need to know how to apply, you can as always go and check that video. And don't feel discouraged, because yes, at times the grade are a little bit higher for some people because they say they got a C- and now they wanted to do a diploma. But you can always start from a certificate. I've seen so many nurses out here who have even done their degree and are doing their masters, and they say they started from a certificate. So you can always start from a certificate, do a diploma, and just go on and so forth. So it doesn't matter. If you just have the grade to start somewhere, you should always start from some place. For me personally, I usually advise guys to do nursing. Not that I'm against the other courses, or not that I don't like the other courses. All the other courses are as well marketable, but personally I usually prefer nursing, being that, you know, for nursing we require so many nurses, like in the hospital, so it's so easy to get a job rather than many other courses. I just don't wanna like share animations because I don't want to discourage someone from doing a course that they want to do. But for me personally, if you come for my advice, I usually recommend people to do nursing, because even apart from getting that job, because we need a lot of nurses, nursing, it's so easy to even go abroad if you want to go and study or work in another country. Because most of the time, even if you see these people usually try and get people work in other countries, most of the time it's usually just nurses. Like, nurses are required as, I can't even say, like, we require more nurses more than any other medical profession. So that's why I usually recommend people to do nursing. Not that it is easy. It is not easy, because at times I usually say it is the most difficult. Not because it is easy, but usually look at the later, like the future. It is so easy to get a job. So that is the reason. But it is not that it's easy, because for me, nursing, I think it is so stressful, because even when you go back to college, the group of people who are more stressed with studies are nurses. So it is more stressing, let me not lie to you. But later on, it is so easy to get a job. It is so easy to even advance. Like, it's so beautiful as long as you have the passion. And even for clinical medicine, like, it's so nice, because I've seen so many people who have done clinical medicine just go out here and open their own clinics. And at times I usually feel like I should have done clinical medicine. So that's why I'm telling you, every course is good on its own way. So you just have to look at yourself personally and decide what you want to do and what is good for you. Then the other thing is that whenever I'm trying like to advise you on nursing and to advise you on applying for a course in KMTC, it's not like I'm working for them or they're paying me to be able to advertise their courses. That's not it. It's only that I've experienced and I've heard from different nurses. And personally, like, if you start from diploma, that is most of the time usually KMTC, like, you get, can I say, more knowledge, because for us we do a lot of practicals. I think I've said this so much on my previous videos. We do a lot of practicals. So by the time you become a nurse, or by the time you even decide to advance, you're usually so much knowledgeable, not on the books that you read, but on the things that you see. Because nursing is not all about reading the books. Nursing is about what have you seen and what is it that you can do. So that's why I usually like it here, because we do a lot of the practical stuff. So if you want to do it and maybe you haven't gotten to the C, maybe you even have a C minor, you can always start from certificate. I usually tell people this because someone will tell you, I don't have the time to start from certificate, but I really want to become a nurse. And they don't have that C, they have a C minor. So I usually just encourage them, like, you can always start from there, then you can always advance. Like, everyone who is great started from small and went on step by step. So if you're passionate for nursing and you really want to do it, then just go for it. And you can always just ask around, because most of the time you find that people just jump into these courses all because they think that is what their grade got them to do. Like, I couldn't get to the university, and maybe you got a C, and you feel like you can't get to the university. Now you are stuck, and you've heard there's a course that is being applied in KMTC and you can go in with a C. Now you just go into nursing because you have a C, but not because you want to become a nurse. It is going to be so difficult for you. Like, I've seen people feeling like they just want to finish school and then they drop everything all because they started it but they didn't have that interest. So even before you decide that you want to do that course, let it not be because of that grade. Let it be because that is what you feel you want to do. So even if you're pushed to do this, like me, I don't know why even nowadays you find that parents still push their children to do courses only because maybe they couldn't afford to become a doctor. They want to push them to become a nurse for you. That's why you find that most of the time they'll come, do nursing, finish, give that certificate to you because you're forcing them to do it. So do these courses because that is what you really, really want to do. So today I'll just be doing a video about the grades that you require for your diploma course, but another different video I'll be doing soon, a video on the difference between the degree and the diploma one. What is the difference like in terms of grades and even in terms of experience. I'll be talking to you guys about that, and even why someone will choose to start with a diploma and yet they even were able to apply for a degree. So thank you so much for watching this specific video, and see you on my next video. Bye bye.